Hello, my name is Brianna Johnson, and I will be outlining the issue of euthanasia and physician-assisted suicide. I will be going over what these processes are, the decision-making, common myths, and why euthanasia and physician-assisted suicide are viable choices for end-of-life care. Why you or your loved one should choose euthanasia or physician-assisted suicide. Euthanasia and physician-assisted suicide gives your loved ones the option to die with dignity. Euthanasia and physician-assisted suicide are both painless. Euthanasia is a process of 3 simple drugs which are injected into the patient. The first drug, sodium thiopental, is a sedative which renders the patient unconscious, so they cannot feel what is being done. The second drug, pancuronium bromide, is used to stop all muscle functions and respiratory arrest. Potassium chloride, the third drug, is used to stop all internal body functions such as breathing and the heartbeat. Physician-assisted suicide is merely a lethal dosage of morphine, a strong opiate painkiller which the patient can take of his or her own accord in the comfort of his or her own home. Both of these operations are done in a controlled setting, either in a hospital room or in a safe environment surrounded by friends, family, and people you love. There is a lot of careful deliberation that goes into the decision-making process and strict criteria that a patient must meet. The first is a less than ideal prognosis, usually less than 6 months. The next is unmanageable pain or a compromised quality of life. If the patient is not able to live out the last of their time to the fullest they can, they are likely a strong candidate for euthanasia or physician-assisted suicide. The last, and probably the most important, is a stable mental state. It must be understood what the patient is choosing and that they are in the right state of mind to choose it and they understand the consequences. Euthanasia has a very bad reputation due to some common myths believed about what euthanasia and physician-assisted suicide is. The first and most common is murder. Due to some past offenses, it is commonly believed that doctors often agree with euthanasia or physician-assisted suicide to murder their patients. This myth comes from a doctor from 1959 to 2011 who took pride in his part in a patient's right to die and openly admitted to, quote-unquote, killing 130 patients and even took on the nickname Dr. Death. The second and more personal myth, is giving up hope. It's commonly believed by loved ones of patients that are choosing to end their own life in a controlled manner means that hope is lost. They do not understand that the patient is already beyond help. That being said, that gives patients good reason to choose PAS and why you should be on board with it. Physician-assisted suicide and euthanasia offers a patient who is in tremendous amounts of pain a dignified death. No one wants to die having lived the rest of their life in pain, and everyone has the right to a peaceful, dignified death. The other reason being that suicide is always an option. There is a distinct line between suicide and euthanasia or physician-assisted suicide. physician-assisted suicide or euthanasia give the patient and his family peace of mind, safety, and serenity, while a patient is still entirely liable to take their own life without having a controlled setting or being surrounded by their loved ones. With these facts in mind, I urge you to consider your loved ones and their end-of-life care. I encourage you to consider what could be best for them. I encourage you to give your loved ones the right to die with dignity and not feel ashamed. Thank you very much.